when we talk about improving operations when it comes to patient experience, and I'm talking about in optimizing workflow, improving coding, improving registration, decreasing waiting time. This is all a different kind of elements that is really affecting the good process of any hospital when it comes to operation. Do you think that really today everybody's talking about AI? Everybody's talking about innovation. Everybody's talking about we want to do this and we want to get this integrated into the hospitals. But where are we really today? When it comes to integration of technology, into the hospital operation, especially to improve the outcome of the patients and the patient experience when it comes to operations. So how do you think that this can really happen, and where are we now with this?
I think it's a great question. Different healthcare systems have different rates of adoption of AI and technology based on the problems that they face. Right? If you look at, for example, UK or Canada, their problem is very much they have a lot of demand and they simply can't manage it. So sometimes experience is not as a luxurious experience is not top of mind. It's making sure patients are in and out so we can see more patients. In private commercial healthcare, as we see in a large case in UAE, the challenge is, well, we need to provide a good experience, an exceptional experience, yet you're in competition with other hospitals and other networks as well. So you have to provide an experience that is over and above just something fast and efficient. Patients have to feel like they're getting something more. So the role of technology in that has to be providing solutions to both problems, I believe. One, in helping patients get in really quickly with the least number of touch points as possible. And for that, hospitals in this region, they're adopting what I call digital doorway. Ideally being able to come in, and it's already in practice in a few hospitals, being able to come in and not having to talk or register with any clerk. You can come in, log in online, you know where to go, it'll tell you where to go sit, and the nurse calls you in. The sticker's generated, you're ready to go. Right? And you can pay for your deductible online as well. Mm-hmm. That eliminates the need to have to meet 2 or 3 people and get your insurance verified by them before you take a seat. So that's one of those ways to make things efficient. Also, it provides a channel for patients to interact that they're used to. Right? With the population base here, everybody has a phone. Many people prefer to use channels like WhatsApp and digital channels to actually interact and engage. So the role of technology now is to provide more avenues to do that, not just call center, not just waiting for a human to pick up a call. On the experience side, what I'm noticing here in the region is more and more capabilities to provide a better experience, not just when you visit the hospital as an outpatient, but also when you're an inpatient, mm-hmm. right? And it also solves a practical problem. As a patient, your needs are more than just a nurse having to come and cannulate or change your IV, but blanket, room temperature, food, cleaning. These are all services that oftentimes nurses are not able to do because they're stretched. Yet with the use of AI, you can actually now provide input, this I need food, I need room temperature control, and actually route the service to the right person, a porter, somebody in facilities, maybe a vendor to provide that service. So here you have AI providing options and capabilities to a patient that could be seen as a luxury offering now. Maybe one day it'll be seen as default, but you're actually saving costs as a hospital, not interrupting nursing time, improving nursing care because they're now focused on clinical care, and allowing other members of the organization to serve that patient in a quicker time. So these are 2 very practical examples we're seeing already in application in quite a few hospitals.